Hello, this is Susan Clinton, and welcome to this episode of Tough to Treat. Today, Erica and I are going to be talking about a professional dancer that has pain mostly on one side of her body, just the left side. And we have just completed CSM of 2019 in DC, and we are both having a very cold winter day today. By the time you listen to this podcast, I hope you are dry and warm and having a great time thinking about the emerging spring at some point. Thank you and enjoy this episode. Good morning, everybody. This is Susan Clinton, and I'm with my co-host, Erica Mello, and we are Tough to Treat. How are you today, Erica?
I'm good, Susan. Thank you very much. Been a dreary winter day here, and I know we always talk about the weather, but it's been such a dreary winter. And you're out in sunny California.
I am. At the time that we're laying this podcast down, I have moved from Tempe, Phoenix, where I was the last time, to Oakland, California. I've been kind of on a teaching trip these last 2 weeks. So I teach this weekend, and then I'll be heading back to Pittsburgh in time for, I think this is the middle of January, so big snows are on the way. We'll see how it goes with everything.
Yes, I know. I love snow.
Yes, me too.
I'm traveling.
Okay, so let's get to it.
Yes.
Today I have a young dancer, not a young dancer, she's in her 20s.
Okay.
That came to me on insistence from other people, which was kind of funny. Usually they kind of seek me out, but she actually had a number of people say, you've been kind of dealing with this for a long time, you should really go and see Susan. And so she came to me via the Pilates instructor that I work with here in the Pittsburgh area. Mm-hmm. And so we came in, asked a few questions. What are you dealing with? She said, my entire left side of my body feels like it's tight. I constantly have to feel like I have to stretch. Mm. So, and that's what she started out with. So the first thing that went through my mind was, all right, is this going to be something that's a little bit more like is this a brain smudge that's, kind of taken over the left side of her body? Or, what's been happening here, realizing that she is a dancer? Is this a dominant side that is like being overloaded with choreography? Because sometimes choreography can challenge one side way more than another side. Yeah. Particularly if it's choreography that has to be repeated a lot. Mm-hmm. So I just sat with her and asked her some questions about, kind of when did this all start? Well, it's, I've always had this kind of funny thing in my leg, for since I was a teenager. That feels like I just sometimes have this pain and tingling in my leg. But she said it comes and goes, so I've never really worried about it. But then it seemed like my hip started getting tight, and then my back started getting tight. And she just said it just started progressing over the years. And now it feels like it's up in my left shoulder and my left neck. And
so it's her entire left side. Okay.
Yeah. So when she said entire left side, she meant it. So
yeah, you're not kidding.
I think the only piece that she didn't talk about was her foot, which was interesting.
Yeah. Interesting.
That's funny. So, we just kind of visited. She has been doing some interesting, challenging choreography. And she said that it seems like this comes up every time more in the fall when they get ready to do a particular show that they do. Not the Nutcracker. It's another type of Christmas show that they put on. It's like their fall, gala thing that they do. And some of the choreography repeats every year because everybody loves it and comes to see that particular piece. And so, so it was a little bit driven by that. But she said, but in the spring, it's still there too. It's just not as much. Depends on how much she's dancing. So I spent some time just kind of probing just a little bit more, was there, how's it going? Does she carry a backpack? Does she carry her bag on one side? What other things make it worse? Does it, seem to be worse after you don't do anything for a while? Or does it get better if you rest from dance or, take that day off or those 2 days off? And really not a whole lot of change. Sometimes maybe it feels a little better, sometimes not. You just can't really get a pattern to it. Mm-hmm. So I said, okay, so let's just kind of see what comes up as we start moving, because sometimes you know how this goes. Once you get them moving and doing things, and it's like, oh yeah, and such and such,
Yes.
you know, and such and such. So I thought, well, let's just get moving here a little bit and see what, you know, what we can reproduce, what we can do, you know. And of course, here we have somebody who is a dancer and she moves very well. So I'm not going to reproduce her pain, which is some movements, or at least I'm thinking that way, that it's going to take more, end range movements and maybe more fatigue to kind of expose some things with her. So we just basically did, I just started off with one of my favorite things is, bend over, let's see what happens. And she did, and she said, it feels the same tightness that I usually feel. I said, is it worse when you bend over? Yes, I feel more of it when I bend over. It's not really worse, but I feel it more, is what she said.
Question, Susan. Is it tightness on the anterior part of her leg or the posterior part? Or
posterior lateral.
Posterior lateral. Okay. Got it. Okay, sorry to interrupt. Yeah, I'm sorry.
No, that's okay. Perfect. Because as we stayed in that bent over position for a while, she said, now this is interesting that I'm starting to feel the stuff that's on the side of my lower leg. So below her knee on the lateral side, she was starting to feel kind of the kind of pain and a little bit of the tingling that comes on there.
Okay.
When she was in a bent over position, she had pretty good hip flexion. And it got a little bit better as she stayed there. For a dancer, when you're thinking about, bending forward, it's not a normal range of motion you might see with other people, so she was, pretty flat, going down and a lot of hip flexion. So there wasn't really anything like, oh, she's not moving there.
Right.
So, I just kind of like took her back and said, okay, let's just see what happens when you lean backwards. And a lot of limitation leaning backwards and some very sharp pain right into her lumbar spine.
So she was limited in a back bend?
Yeah.
That's surprising for a dancer.
I know, right? So, okay, we have more than one thing going on here.
Yeah.
There's a combination of something happening here. So I said, okay, just let's try this. Let's squat down and see, just squat down like a catcher and let's see what happens here. So she could get into a squat position. She had tightness, but it wasn't as bad. Her leg bothered her a little bit. And I said, okay, so squat in a position, bring your feet in, bring them out, do whatever you need to do, but make that leg pain go away. So she experimented around with a few positions and finally got into a position where if her legs were a little bit more externally rotated and a little bit further apart, then she could squat all the way down without anything going on in her leg.
Okay.
And her back just felt tight and the neck felt tight. But, I didn't imagine we were going to clear that up. I wanted to get rid of the leg pain and see if it would change with, a change of position. So go ahead.
A wide base of support and the hips in bilateral external rotation.
Right, yeah.
Okay.
Just turning the feet out a bit.
Yeah, like a plie. Yep.
Yep, exactly. Yep. So she, so then we stood up and squatted down a few times just to kind of, change some things up and see if that would change some of her tightness. And as she was doing that, she said that she wasn't feeling anything in her leg and her back was starting to feel a little bit looser. And I said, is this something that you've ever done when you feel the tightness? And she said, no. And then I said, well, what do you usually do when you feel the tightness?
Yep.
And she bends over with her knees straight and says this, or she puts her leg up, on the bar, and I try to stretch it out that way.
But she bends over with her knees straight, but didn't that reproduce her posterolateral leg pain?
Yeah.
Okay.
So she's
bend over. That's what she does to relieve her symptoms.
Right. So she actually pushes into her symptoms to try to relieve them. So,
got it. Yep.
She feels this tightening, and so she wants to push into it harder to make it better rather than to figure out another way to go to make it better.
Yep.
So after we did, 4 or 5 squats and her leg felt better, I had her stand up and I said, just lean backwards again and let's see what happens. And it was better. So I thought, this is very interesting. And she was kind of like surprised. She goes, okay, how come that got better? And I said, we're just moving your neurological system around And sometimes when we do things a little bit different, it takes it out of pattern and you
Yeah.
don't have the same experience. Let's just see what happens when we do a few other things.
Yeah.
So we got on the table, and I had her do just some press ups, and that didn't bother her at all. It felt really good. So it seemed to me that if we could get her out of compression, she does a little bit better.
Was she hinging anywhere? Like, was she hinging, or?
She really wasn't hinging too much.
Okay.
She was, if she was hinging at all, it would have been around L4-ish, where you usually see, the crease or something. But, her back was in out of weight bearing. She had a very nice, extension.
She was able to, got it. So in weight bearing, she couldn't,
Right.
it was more limited. Got it.
Yeah, it looked like she almost compressed down.
Yeah. Okay.
So we were just talking a little bit more, and I asked her, I said, do you have any fatigue? Like, do you get tired? Do your feet get tired? Does your leg get tired? Have you been tripping? Anything? And she did say, she goes, after I do a lot of point work, that I feel like my left leg is more tired than my right leg, kind of, trying to go up onto point. But she said, I just rested. It seems to get better, so I don't worry about it too much. So I just kept asking a couple more questions. And I said, have you had any injuries? And, besides dance injuries, like, did you fall down the stairs? Have you been in a car accident? Have you had anything that's gone on? And she said no. She said that she did have a fall when she was a teenager, but she said it wasn't a big deal. But she did say, after we were talking about it, she goes, that's when the leg pain started.
After the fall.
After the fall. So, so I just started kind of thinking, this is very interesting, because more and more this is sounding like a old nerve root injury that for some reason is just continuing to go on. Or it's just, it just seems like it's continuing to be irritable. Because the extension and standing, gave her localized pain.
Yep.
And then flexion, gave her the pain down. And so usually we talk about not doing a Dural test and sitting with these people because you can't get them far enough. Yeah. But what I did was we did the straight leg raise test, but we did it, bringing her leg all the way back as much as we could.
Yep.
But it didn't chime anything off because the other leg was down. And in standing, both legs are in the same position as the trunk bends all the way over. Correct. So I decided, let's see if we can reproduce it on her back.
Yep.
So we brought both feet up, straight legs all the way up, to almost, to her head.
Yep. And
then flexed her feet, and then really flexed her head down, and that went back on.
Wound it right up. Yep.
So I said, let's see what happens if we do this. So we brought her legs apart by about 30 degrees. So she's in 30 degrees of abduction, between both of her hips. So each hip at about 15 degrees of abduction, right? So she's in a bit of a V. And we bring the legs up again that way. Flex the feet and bring the head up. Nothing. Everything's fine.
That's similar to the external rotation and standing that you had her do.
Yep. In the squat, right?
In the squat, right.
So then we brought her feet together and crossed them over.
Ooh, I love that.
And started to bring her up, and she couldn't make it halfway.
I love that.
Started to come on.
Crossing midline, you really wind that nervous system up.
Yep. I had to see. And I thought that this would be a fun case to just go through, because I know we talk a lot about neural tension, but this one was just so clear. That the further apart her legs got, the better mobility and motion and everything without symptoms she had. The closer to midline we got, the worse it got.
Fair. And so you literally crossed her legs like a scissors.
Yep. One leg over the other.
And then just straight leg raised her that way.
Yeah.
Oh, that's fabulous. Yep.
And I just thought it was amazing that, you could see it that clear. And it was really good, because it was very instructive for her. Because, during bar, she, when you cross midline at fifth position, there you are, so she's good in first position, better in second position, worse in fifth position. And, so we got up to bar, and I said, let's test this out and see, show me, let's go through this. And so, we went through the various positions at bar, and yes, she was definitely limited if she was going to do a full bend over at the hips all the way down, in fifth position with her knees straight. And so this is also some of the problems she was having with some of her developés that were coming into, front and, really bothered her, whereas side developés, going into second position and straightening the knee out, didn't bother her as much. So anytime she went away from her body, her body kind of moved away from itself, she did well. It was as soon as she crossed. So her fatigues come in a lot when she's doing things like, she says, it's more turns. And that would make sense because in ballet, you're crossing midline to turn every time.
Yes.
And it would depend more on if she was turning with her left leg on the ground than if it was her right leg on the ground, because that would make sense, because if you're turning with your right leg on the ground, the left leg is away from midline, pointed out, the knee pointed out from midline. So I just wanted to see kind of a couple of things. So I just had her, I said, I know this is going to seem a little bit crazy, but I just want you to put your fingertips on the wall, and I want you to, on your right leg, go up and down as many times as you can before you just feel like I can't do it anymore.
You mean like a heel raise?
Heel raises.
Yeah. Just on the right side.
Yeah. So she ended up doing, I can't even remember how many. It was an incredible number. I kind of was just like watching the clock. So, a minute or so later, she said, I'm starting to feel tired. I mean, she was, this is somebody who does this all the time. So she should, that makes sense. She should be able to do that. And it should take a long time to fatigue. Yeah. And so we did it on the left side, and in about, I think it was like 30 or 45 seconds, she said, I'm really, really starting to feel weak. And it's like, okay, so it takes a lot to get that, to get the weakness to kick in. Reflexes were good, which was good. I mean, really good, strong reflexes. And sensory stuff hadn't changed. I mean, she does get the paresthesias, but she wasn't getting like a patch of of sensory stuff. And, toe raises, I mean, standing heel raises, walking on her heels, everything was fine that way. So this is going to be somebody that you're not going to be able to do a typical break test on, right? To see if there's any kind of neurological weakness, with them.
Yeah, it'll have to be more.
You have to get to fatigability. You have to do a lot more to get to fatigability on somebody who's super strong in that muscle group than the average bear. So, so we did have a little bit of fatigability issue, but nothing that I felt like was going to be, I mean, she wasn't showing any other signs that something needed to be imaged or looked at. I just think she needed to get into a place where she could understand why she doesn't want to push through this the symptoms, because every time she's stretching those nerves in that way and she's getting the symptoms, she's getting the pushback, and it's not changing, so and maybe even getting into some areas of a little over recruitment here, over recruitment there, which can be dealt with later. First we just got to get these symptoms out of there. So my interventions were, to do the neural tension work, but to do it closer to end range and to stay out of symptom.
Oh, stay out of symptom.
Yeah. So I wanted her to snuggle up next to the symptoms that she would get, but not push through them.
And what did you do? Just like straight leg raise?
Yeah. So we did, I just said, bring your legs up, hold here. So she likes to stretch. I said, so this is kind of a stretch, but it's going to be one that isn't going to give you symptoms. So she grabbed her ankles and pulls her ankles up, towards her face, with her knees straight. Yeah. And then she pushes her legs back out a little bit, and she plays with where is that line, that tension line coming through. And then when she gets to the point of where she feels it, she backs out just a little bit, and then she works her feet up and down. And
is she in that 15 degrees of abduction?
I had her come a little bit more closer to midline. because she would get out of symptom if she didn't pull her feet off, her ankles all the way to her face.
Got it.
So, and then though, for variance, I did have her work in the 15 degrees of abduction, and I also had her kind of start to feel how far can you go with your legs crossed.
Yep.
So she worked in all of those planes, and she could work her head or her feet. And that was just, something that she could do right before class to ease things up and get things moving a little bit better.
Yeah, she was stretching into forward bending as a response to her symptoms,
Right.
and in a weight-bearing position, which loads those structures differently. And you're telling her to go in more of an unloaded position, but get herself more into more end range, and just play with the ankles, and then vary the base of support in supine. Yep, got it.
That was that was one exercise. The other exercise was when you're standing around and it's bothering you and going down your leg. I want you to drop into that squat. A few times. Yeah, like you talk about with the reset exercise. The squat became her reset exercise, and I said you can do that during bar. You can do it in between. You can do it before center floor. That can be your go-to thing to do to kind of just reset. And get that better. And then what we did was, she really wanted, she goes, what am I going to do about bar? Because, I have to go into fifth position. And I said, well, let's play with that a little bit. So that's a crossing midline, and knees straight and, bending over and how far can you bend? So we would go through it. And I said, here's what you can do is when you get to that point in fifth position that it starts to bother you, lift your head up. You don't have to have your head all the way down. I said, just lift your head up. And it would immediately relieve it.
Yeah.
And I said, okay, so there you go. Just stay and just play with where your head needs to be. But I said, stay out of symptoms there. I said, it's not for everything that you do at bar. It's just when you get into these positions, when you feel it, that's when you have to pull back out of it just a little bit. So obviously second position was her favorite position to do it in because nothing came on and she could go all the way down. First position was getting better, but she still had some rules to follow there. And so in weight bearing, I just had her move her head up and down rather than, trying to, but she could have bent her knees a little bit and straightened her knees. She just really liked doing her head. That she just wanted to keep that ballet pose and that, bar position. So the head was the one thing we could agree on that was easy to do and wasn't going to change what she was trying to do at bar.
Got it.
But you very well could have gotten into that position, just had them bend their knees a little bit.
Yes.
To alleviate the stress and then bring it back on.
Yes.
So, and so that's kind of what we ended up doing. I told her, I said, she wanted to know if she should be doing those toe raises as an exercise. And I said, no, you do plenty of them. I said, I just wanted to see maybe what was going on. I'd like to see this again, in about 6 weeks and see if it begins, if that's changed a little bit.
Yeah.
I said, but just make note of the fatigue. And if you are, drop down into a squat, maybe, and, or, walk it off. Or if you're doing, choreography and you're just marking, just really be sure you're only marking and not going full out till you have to go full out.
Yeah, and what she could also do is sometimes when I have patients who have symptoms during like an athletic endeavor or a dance or whatever, so I use like a self-check. So her self-check is the fatigability is her left heel raise. So she could go do all her, her neural, her resets or her neural glides and then check the calf raises. And if they're like 15 or whatever number, we'll say 20 and she's fine, and then she does bar class and then she checks her leg, and if she's down to 10 then she that something in the class obviously
that's a great point. I love that. I think I will email that to her,
and then she can do her resets or her thing. That's a good self-check for people.
That's an excellent self-check for her.
Yeah,
that would be really good. Yeah.
If and I use that a lot for people who have who go into with their trainers and they're doing different exercises. I think I've mentioned this before.
Right.
And I'm like, one-legged, whatever it is, one-legged standing, heel raises, squatting, whatever. Do that, and if it's worse, there's something you resorted to an old strategy, or there's something you're doing, and so do your reset. A reset's an easy exercise that you can do symptom-free. And then that should reset your system. So she could do that easily. I mean, that's an easy program for her to follow, I really like that. So in terms of this fall, I always tell patients, I always ask if they fall. There's one question I ask every single patient because and I know probably everybody does as well, but it's so important because even if they fell, 15 years ago, and they have pain on and off for 10 years, it could be relevant,
Yeah.
especially with the persistent ones and the hypermobile ones. So, people will say, oh, I had a fall, but it was so long ago. And I'm like, how long ago? They're like, oh, 2 years ago. I'm like, that's not too long ago.
Yeah. That's still relatable. Yeah.
That's
No,
still
I just thought it was
relatable.
interesting, not trying to get in and do diagnoses and, all of those other kinds of things.
Yeah.
My hypothesis was that she had this fall at about the time that her long bone growth was going on.
Mm.
And in girls, their hips change during the long bone growth and the onset of menses. And I think she just kind of had a little bit of a perfect storm set up in there. Not bad enough to stop her from doing things, but that's kind of where that irritation started, and it just never really had a chance to change.
Yeah.
And so now she's just giving herself, a chance to get that nervous system to maybe settle down just a little bit.
Mm-hmm.
And by staying out of the symptoms, she's not going to have the over recruitment pushback from stretching into the symptoms.
Yep.
So that gives her a chance for those nerves to start gliding a little bit differently and hopefully longer, so that she can access those deeper range of motions that she wants to access for her dance, for her craft, without getting the pushback from her system.
Yeah.
So
yeah.
that was the reason I chose to go that way. Whether you want to say what came first, the chicken or the egg, doesn't really matter. We still have to treat it and give them some options of movement that they can actually begin to change their symptoms, with the hope that the idea behind it being, or at least my theory behind it being, that if I can get that to change, then she's going to change overall, and she's going to have less and less of that whole left side feeling like it's being pulled all the time.
Yeah.
So
yeah.
Mm-hmm.
And so have you seen her just once so far?
I've seen her once. I'm going to see her again when she comes back for spring break.
Okay.
And but I'm going to email her and set up a call and talk to her and talk about doing that reset exercise. Now, first I'm going to see how she's doing.
Yeah.
And I haven't heard from her, so that usually means good things.
Yeah. Yeah.
Means things are probably going along, but I'm due to sit down and give her an email just to kind of remind her about this, remind her about that, find out how this is going. Do we need to hop on a quick call for a few minutes just to talk through anything to see if anything needs to be changed based on what you're seeing now? And I'll give her that reset exercise.
Yeah.
Not the reset, but the
self-check.
The self-check exercise of the toe raises, because I think that's amazing. I think that that'll really help her kind of stay on target as to what it is she's trying to accomplish.
Yeah. And so would you, let's say when she comes back and she still has to cross midline with her pirouettes and all of her rotational components of dance. How would you, I'm just thinking ahead, start to address that, with treatment in terms of, I would probably assume you would start to cross midline with the straight leg raises, or would you do something else?
Well, we're already crossing midline with the straight leg raises.
Oh, you are now? Okay.
Yeah, so, but just not going very far, going right up to it, but not into it. And then she's doing the, fifth position bend overs as well.
Yes. Okay.
In weight bearing.
Yes.
So, yeah. So, and I think by adding in that self-check exercise, we're going to be able to monitor the fatigue.
Right.
Much better and see if that's improving. So it'll be interesting to see. I will see what she looks like when I see her again. But I thought that this was just really just kind of an interesting case of really looking at neural tension and how you can really change it. And a lot of people forget that crossing midline can really wind up that nervous system quite a bit, especially when that may be a little bit irritable.
Yes.
And
yes, I agree with you, and I don't think people should be afraid to do that, especially with someone who's had this for so long. It's not like they have an acute nerve root injury or something. It's a long-standing issue, and the way she was stretching herself to make herself feel better, she was making herself worse. And I always get leery when people say, I feel like I need to stretch all the time, and I'm stretching, and I'm like, that's raising not a red flag, but a yellow flag in my head, and going, when you feel like you need to do that, there's something possibly with neural tension. I don't know, but this is a great example of that, and people just don't be afraid to load some of these people up, especially the persistent ones. And, and I think that, going into midline, I remember, I don't know what course I took. I think Lorimer Mosley, David Butler course some years ago. They were like crossing midline really stresses the nervous system, and not in a bad way, but it it's just the physiology of it. So, and I think that
it makes it work in different patterns in different ways. Yep.
Yeah, and even with upper limb tension, you could cross midline, do both arms at the same time, similar to the last podcast that we had that I did with my patient, the one who had the arm pain. It's your imagination. Just use your imagination, I think.
Absolutely.
Yeah. Well, great. This was awesome. I love this one. This is a good one.
Thank you.
Very cool.
Great. Thanks, everybody, for listening. And Erica, do you want to make the announcement about some of the things we've got coming up this next month or the next couple of months?
Well, we are, well, number one, we are on our website. We have our opt-ins on there, and I have an opt-in on some patients I've treated in a chapter of my book, and Susan has her great sleep document that we have on there. We're going to be updating that a little bit, and we're also going to have some guest listeners on, and we already have 2 people lined up, and we're going to probably do this maybe once a quarter. Okay. Yeah. And if anybody has any tough to treat patient that they want to our advice on, you can email me or Susan, and we will put you on the list, and we'll eventually set up a time to record. But we're going to do 2 right out of the box. We've already got those set up, and then we're going to do once a quarter from there on. So looking forward to doing that. It'll be it's a nice change, nice switch.
Yes.
I think it's great when we talk, but I also like to hear other people talk as well.
Right. It'll be fun to go through the process with different people and different problems that, we haven't encountered yet. So
yeah. And we're also going
to it.
Yeah, I know. And we're also going to do our mentoring mastermind. So that's going to be a fantastic thing we're going to do as well, going into probably end of first quarter, second quarter. So looking forward to sharing those details. And I think that's it. Did I miss anything?
I don't think so. I think we got it all.
Okay, cool. All right.
Till next time.
Sounds good. Bye.
All right. Bye.